Welcome everybody to the Worcester Senior Center Distinguished Speaker Series. Today we welcome Commissioner Kim Roy. Commissioner Roy is appointed by the Commission by the Governor and sits in the designated public health seat. Commissioner Roy will be providing educational information and medical and adult use cannabis. She will also be presenting on the mission and role of the agency, the state of the legal industry, and her priorities as a commissioner. Welcome, Commissioner Kim Roy.
Good morning. Can everybody hear me okay? Can you hear me? I'm projecting in the back. Well, it's a hot one, isn't it? I'm so happy to be here with all of you at the Worcester Senior Center. I've been here many, many times in my previous role with the Worcester County Sheriff's Department. But today I'm here to talk to you about cannabis. So who wants to learn about the legalized cannabis market in Massachusetts? First, before we start, I want to thank a few people, and of course I want to thank Suki Lapin. She does such a great job. Why don't we give a round of applause for Suki? I was so excited when she invited me here today. I also want to thank, as you can see in the back, they're recording cable services, the city of Worcester, so this will be on your cable access television as well. I want to thank Jim, the IT person who got me this great mic and clicker, so thank you, Jim, for that. And I want to thank the director, Amy Vogelwaters, for always having such, you guys are so blessed. This is one of the most vibrant, robust senior centers, and I've seen them all in Worcester County, and there's always great activity here. So what a special place the Worcester Senior Center is, and I'm so proud and happy to be here with all of you. So a little bit about me, and thank you for that kind introduction, Suki. So I'm a commissioner with the Cannabis Control Commission, and there's 5 commissioners. I'm one of 5. And I sit in the designated public health seat. So Commissioner Camargo sits in the social justice seat. Commissioner Concepcion sits in the public safety seat. Our chair, you might recognize her, Shannon O'Brien. She ran for governor years ago, and she was our former treasurer, and now she's the chair of the Cannabis Control Commission, and she's done a tremendous job. And then Commissioner Stebbins, he's in the regulated industry. He came over from the Gaming Commission. So all 5 of us have a lane, if you will. Overall, we want to ensure that the cannabis industry in Massachusetts, that we uphold public safety and public health and public welfare, that you know that your products are safe and tested in a legal market. And this is new, right? I mean, I grew up, and you certainly grew up, cannabis was illegal, and it was the illicit market. So this is a whole new thing. I've had to evolve, all in honesty, how I feel about cannabis, and I've seen some amazing things happen, and I'll talk to you more as we go on about this. A little bit about me too. I was appointed, as Suki said, by Governor Baker, and I'm 2 years on the job. Prior to that, I worked for the Worcester County Sheriff's Department. You guys probably all know your sheriff, right? Super duper tall, tallest sheriff in America. Well, and I see a few folks in the back that I used to work with from the Sheriff's Department, Donna and Nidia, so thank you so much for coming, and what a resource they are for you, huh? So that's great. So prior to that, I worked at the Sheriff's Department. I served for over a decade, and I was responsible for all the community programs that we brought to you here. And the senior picnic, has anybody been to that senior picnic? That's a doozy, right? It's like Woodstock for seniors. So I ran that along with Donna, and a lot of great public safety programs that we worked on. But one of them I'm really proud about is a face-to-face program, and it segues into cannabis, is I co-wrote with Sheriff Evangelitis a substance use disorder prevention and education program for young people. And we brought it, how do you go to prison, right? Drugs, a lot of times, can lead you there. Or death. So we talked to the young people, so we don't want them to make the same mistakes that the inmates made. So I co-wrote that. We brought it in front of over 400,000 students, and Governor Baker noticed. And he said, I want to take your experience and I want to bring it over into the Cannabis Control Commission, because former Senator Jen Flanagan, who you may know, was the commissioner before me, and she had moved on. So this has been a real honor. Cannabis, you might not know, is the #1 crop now in Massachusetts. It outpaces cranberries, believe it or not. It is the #1 crop in Massachusetts now. We are approaching $5 billion in sales, with a B, $5 billion in adult use sales in cannabis in Massachusetts since the first store opened in the fall of 2018. So that's a lot of sales. So what's the mission of the Cannabis Control Commission? Because it didn't exist. 2016 is when folks voted on it, and prior to that, there was no Cannabis Control Commission. So the governor, the legislature created one. And what is our mission? Our mission is to honor the will of the Massachusetts voters by safely, equitably, and effectively implementing and administering the laws enabling access to medical and adult use marijuana in the Commonwealth. So boil that down. What does it mean? It means that when you go to a dispensary or you go to a medical treatment center, you need to know your products are safe and that they've been tested. And they've been tested for pathogens, potency, and pesticides. And you can't guarantee that in the illicit market. So these are the things we do in the Cannabis Control Commission. So let's just go over the history of cannabis in Massachusetts. I kind of touched on it a little bit. November 2008, I don't know if you guys remember this, that the voter initiative just to decriminalize it. So that was the first step. So small amounts of possession were okay, and it was approved pretty handily, right? 63 to 34. And then 4 years later, medical marijuana was approved, 63 to 37. And then June in 2015, the first medical marijuana treatment center was opened by the Department of Public Health. So the first legalized cannabis was the medical side, and it was run by the DPH, the Department of Public Health. So the history of cannabis. So you guys might remember in 2016, question 4, which was, it wasn't approved by a lot. If you can see, 53 to 47% voted to approve legalized cannabis in Massachusetts. In July of 2017, Governor Baker signed it into law. In September of 2017, the Cannabis Control Commission was appointed in 2017. In 2018, the initial regulations were approved. As far as regulations and statutes go, there are thousands of pages, and we're changing the regulations now as we speak. We have a public meeting tomorrow, and I'll get more into that. June of 2018, the commission approved the first provisional license, and then the first stores opened in 2018 of November. And you guys might have read about it in the paper, but Cultivate in Leicester, the lines were for miles, right? And we blame it on Black Friday and Walmart across the street, but the lines were for miles for cannabis, and then the other one was in Northampton. So there was only two. There was only two at that time. And now we have over 250 retail options, and there was two back then. So the history again, on April of 2022, we had an exclusivity period. What we try to do is we try to help, and I'll get into this more, communities that have been marginalized when cannabis was illegal. And studies were done, and we identified communities in Massachusetts that had high arrest rates when cannabis was illegal, and we try to help those communities that were harmed during that time. So one of the ways we do that is we prioritize license types for minority-owned businesses to help them get a leg up in this industry, because it's quite an expensive industry. There are a lot of challenges, which I'll get into. Everybody thought it was going to be a gold rush or a green rush, and that's not necessarily the case. So there is significant challenges in the cannabis industry, and I'll go over those with you. In August of 2022, Chapter 180 is passed by Governor Baker, which gives the legislation gives the commission new authority and mandates us to oversee host community agreements and municipal equity programs. So that's what I'm doing now. So I'm a regulatory lead on a working group, and the legislature passed last year a law for us to evolve in the cannabis industry, because there's some issues and there's some speed bumps. And one of those is anytime a dispensary opens in your community, they have to get what's called a host community agreement from the city of Worcester, and then they come to us. And there were some hiccups along the way. So tomorrow at our public meeting, we're going to talk about the changes the commission is making to enact this law. So we're interpreting legislation into regulation, and tomorrow is a big day for us. We're going to make these announcements tomorrow. On a local view, so July 2023, here's what's happening. Everybody Worcester pretty much, right? All Worcester residents here. So what's happening in your backyard with cannabis? A lot. Is July 2023, Worcester has 25 cannabis licensees that have commenced operation. 18, so you have 18 retailers, and 4 of the 14 are medical. Worcester currently allows delivery. If you didn't know that, Worcester does allow delivery of cannabis. And to find a marijuana retailer, if you have access to the internet and a computer, if you go to the CCC website, you say, well, where do I find a retailer or a medical marijuana treatment center? You put in your zip code, and you put how many miles, 2 miles, 3 miles, and it'll tell you exactly where they are around you if you go to our website, if you're curious where to find them. Now, there's billboards everywhere, I know, so I'm sure you know where they are, but, so let's talk about the medical use marijuana program. So why is there an adult use and a medical side? As I said, medical was the first legalization in Massachusetts, and it was run by DPH. And then we had adult use. Now, the difference, one of the most glaring differences is the tax rate. So cannabis is a heavily regulated, heavily taxed industry, 20%. So anytime you go into an adult use dispensary, you're going to pay 20%. Well, why 20%? 6.25% is your sales tax, and then you have 10.75% excise tax, and then a 3% local option tax, which all adds up to 20%. On the medical side of the equation, there's no tax. So I'm going to tell you, for those that are kind of curious, I'm going to tell you here, I'm not here to advocate, I'm here to educate. And I'm here to tell you not only about the industry and the adult use, but if you are curious about becoming a medical patient, I'm going to tell you how to do that today. So let's just look at the medical marijuana treatment center licensees. And you can see Middlesex has the most, but we have 22 in Worcester County, medical treatment centers right in Worcester County. By the numbers, so across the state, there are over 100 medical treatment centers where you can access medical marijuana if you're a certified patient and you have a card. Right now, there's almost 100,000 Massachusetts residents who are certified patients, and my mom is one of them. She has an autoimmune disease. There are 7,310 active caregivers. I'm one of them. So I am able to go into a dispensary on behalf of my mother because I am certified, and I'm able to go in and show my card and pick up her medication for her, so she doesn't need to be with me, and I'll get into how you get that too. There's 316 registered physicians, 117 nurse practitioners, and 1 physician assistant. Now, this number I don't love because we have 100,000 patients and we have just over 400 providers in Massachusetts. It's not a lot. And part of that is the stigma around, you know, there's a lot of, your PCP is probably not a registered provider with us. And so that makes it harder sometimes. It makes it a little bit of a challenge to find a provider. My mother's PCP happened to be one, so it was easy for her. But you can look it up. We don't have it on our website. I'm told it's due to statutory reasons why we can't list all the providers, but if you Google them, they pop up immediately. I can't advocate for one. I have to be Switzerland as a regulator, so I can't say go here or go there. But they are there, and you do need to get certified in order to be a medical patient. So how do you become a qualifying medical patient, right? If you have aches and pains or this and that, well, you want to look into it. So let's just talk about that a little bit. So you have to be, qualifying patients have to be over 18 years of age. They must be approved by a certified healthcare provider and certified by the state before legally allowed to possess up to 60 days supply of marijuana. No more than 10 ounces of cannabis or cannabis-infused products. Pediatric patients require a dual certification. So there's been studies, clinical studies, where medical cannabis has helped with epilepsy, seizure disorders, but for young patients, they need to have their primary care as well as, let's say, a neurologist or a specialist minors need dual certification in order to be a patient. You may apply for hardship cultivation, which allows you to grow enough marijuana to yield a 60-day supply for personal medical use. The commission has approved designating up to 5 patients per caregiver. So I could, not that I want to, but technically I could have 5 people that I am their caregiver for. And patients must renew their status in the program annually, certification and registration. So I just want to pause for 1 minute, and I want to introduce Kathy Oliver Jones. Kathy, could you stand up, please? Kathy's with the commission. She runs our medical program. She's an expert. And Kathy was kind enough here to join me today. So at the end of my presentation, if you have questions or you want paperwork, how to learn how to become certified, or you are a patient and you need to renew, please see Kathy at the end. And she is an expert, and she is so kind and so compassionate, and she really looks out for those almost 100,000 patients. So thank you, Kathy, for joining me today here. So diagnosis and certification. And Kathy, if I missed anything, you feel free to jump in and help me out here. So Massachusetts resident 18 years of age or older has been diagnosed as a certified debilitating medical condition, may become a qualifying patient. So what are some of the medical conditions? And they are in statute and regulations, so let's go through them. So the conditions that can cause weakness, cachexia, which is also weakness, wasting syndrome, intractable pain, nausea, to the extent that it substantially limits major life activities. Qualifying medical conditions include cancer, glaucoma, HIV/AIDS, hepatitis C, Lou Gehrig's disease, ALS, Crohn's disease, Parkinson's disease, multiple sclerosis, and any other debilitating condition as determined in writing by a certified healthcare provider. So if you don't have, you say to yourself, I don't have, those are serious conditions, and I don't have any of them. But the last one kind of gives some area, some room to breathe. Any other debilitating condition as determined in writing by a certified healthcare. So my mother doesn't have any of those, and she's a patient, but she does have an autoimmune disease, and she does have weakness, and she has mobility issues, so she could get her card. So there are different areas that can fall into that last sentence, so you need to talk to your provider, and if your provider isn't certified by the Cannabis Control Commission, and you do find a provider, this is some of the things you can talk about, what comorbidities that you're experiencing that cannabis may be efficacious for. So let's talk about diagnosis and certification a little more. So a qualifying patient, and Kathy, why don't you come up here, Kathy, with me for a minute, so we want to make sure we get it all. This is really important information for those that are canna curious and do want to become a patient. So certified is an electronic document executed by your provider, right, Kathy? So Kathy, why don't you come up here? So a person comes to see go to see their doctor, and the doctor says, you're a good fit for cannabis. I think this can help your weakness. I think this can help with you. What does the provider do? They contact the commission?
Actually, no, the provider does your appointment. They review your condition. Oh.
All right, where's Suki? Suki's got a mic. We'll get it right to you.
I don't want to shout.
Yeah. Okay. All right. So Kathy's going to walk you through the process. Thank you, Kathy.
Thank you, Commissioner. Is this better?
Yeah.
Oh, great. So basically the process is as if you go to any of your healthcare providers. Your medical marijuana healthcare provider is going to look at your condition, and when they determine that you would benefit from medical marijuana, they will actually put your certification, which is like a prescription, in our system. So they won't hand you a prescription slip to go and fulfill your medicine and get your medical marijuana. They're going to put that information in the system. Now, the doctor may also just certify you for a small limit of time just to make sure that the medical marijuana that you're taking is treating your condition. Have any follow-up questions? That's a good doctor that's very much engaged with you to make sure that everything is on point. Once the certification is in the system, then there is a second step that you as the patient would need to submit an application to the commission to get your plastic card. That's one of the biggest gaps that we have. Doctors will say, you're all set. You go home and you're like, or you go home and you sit and you wait for your card. And then when you call my team, it's like, oh, there's a second step. So I did bring with me some paper applications that in case you do want to have that in your possession, where when you get your certification from the doctor, fill that out, mail it into my team, and we'll take it from there. The other thing that a lot of patients tend to overlook is that once the application is processed, it does take about 3 weeks to get the plastic card that allows you to have access to a medical treatment center. So we do provide a temporary that we can print out for you, and you can use that to go to the medical treatment center. So it's important that we have your residential and your mail-in address on file where you're receiving your mail.
Awesome. Stay with me, Kathy,
Okay.
so we're through. Awesome. So that's 2 steps. First with the provider, and then you have to fill out the paperwork. I think you have to prove you're a Massachusetts citizen, right, Kathy? So
Yeah.
I remember showing my mom's passport and an electric bill. You have to have proof of residency. License, passport, electric bill, those types
Let me clarify that a little bit.
Okay.
So as a resident of the state of Massachusetts, we do ask for a identification on file, your mass ID or your Massachusetts driver's license or a U.S. passport. And we also, in our paper application, we don't need the proof of residence because we're going
Okay.
to do everything on our side.
Awesome.
The proof of residence is for our electronic system. So once again, I have paper applications with me, but we do need your ID on file in order to process your application.
Perfect. Okay, hang with me, Kathy.
Okay.
So another difference. We talked about the tax, right? 0 on the medical side, 20% on the adult side. What's another difference is potency. So there's limits in potency on the adult side, but if someone has a cancer pain and they need efficacious pain relief, that's the reason why the legislature, the commission didn't put limits on potency, because you have a lot of patients who have really debilitating pain and they need the higher potency to alleviate that. So that's another difference that you'll see comparing the two. Okay, so this is a picture of the sample caregiver card. This is what I have. Now, don't ask me. I don't know how we got Tom Brady to pose for this. I don't know. I have asked. Nobody's telling me. So anyway, that's the caregiver card. You have to be a caregiver, 21 years of age. And you cannot possess more than 60-day supply. You may not receive payment as a caregiver or compensation or the marijuana for being the caregiver. And you may not sell, divert, use, or consume cannabis or cannabis-infused products that are designated for the patient that you care for. So healthcare providers, you must be a Massachusetts licensed physician, a certified nurse practitioner, or a physician's assistant. You cannot serve, those folks cannot serve as personal caregivers. And there is no fee, so it doesn't cost you anything to register with us, right, Kathy? There used to be a fee, right, years ago?
There used to be a $50 fee, and we eliminated that. But here's the thing. A lot of people think, well, I paid you to get my card. We hear that all the time. I sent you money. The money is the fee that you pay to your healthcare provider for their services. There's no fee to the commission to get your medical marijuana patient card.
Perfect, okay. Okay, telehealth. So during COVID, the commission instituted telehealth. And so it used to be that you could, in the regulations, which we do have to change, your first visit had to be in person. But due to COVID, telehealth, I'm sure all of us had telehealth appointments, including myself. So we created telehealth, which the commission, the 5 commissioners have granted extensions on telehealth. So that still is in effect today, that if you decided you wanted to be a marijuana medical patient, you can do your visit via telehealth with that certifying provider. Okay, adult use. All right, so you must be 21 years of old in Massachusetts to purchase or grow adult use marijuana. You cannot use cannabis in any form in public places, although we've all seen it. It is still illegal. Just like alcohol, it's illegal to have an open container in any form in the car, and it's illegal to drive while under the influence of cannabis. I just want to pause right here. As commissioners, we work on regulations, we work on policy, we approve. So every license gets approved, comes before the commissioners. And so if you walk in a dispensary, my name's on a license. You'll see it. There's 5 of us. So they come before us. As commissioners, we can put conditions on a license. So if I see something, it's not quite robust enough, I can hold it up, put a condition, and say, until you fulfill this, you cannot get your final license, your commence operation. So, and that's some of the things we do. We meet with stakeholders. We do public speaking. I testified a few weeks ago in front of the State House. So those are a few of the things we do as commissioners. But in my individual capacity in the public health I told you about that face-to-face program that I wrote with the sheriff, right? So when I started as a commissioner, someone brought to my attention that in the driving schools in Massachusetts, they don't teach young people about impairment in cannabis behind the wheel. Nothing. So that was a real shock to me. And when Governor Baker swore me in, I said, Gov, I'm going to work on this. I promise I'm going to work. He couldn't believe it. So former Lieutenant Governor Polito, she helped me along the way, and we put a working group together, AAA Northeast and the, Mass DOT. And last December, after over a year, AAA had a curriculum built called Shifting Gears, the blunt truth about marijuana, but it was for just health classes. So we changed it up and we tailored it for Massachusetts. Around Massachusetts laws, and so in December we announced Massachusetts was the first state in the nation to teach young people about the dangers of driving high in Massachusetts. We were announced, and since that, 10 other states have called and want our curriculum. So I'm really proud of that. Something that I've done as commissioner, because we want to keep young people safe. They've heard, I drive, they go on YouTube or TikTok or different platforms, and they see different videos that kind of might promote it or encourage it and glamorize it. So how do we teach them the real facts? about if you feel different, you drive different. And, you know, same goes for adults. If you feel different, you drive different. And like edibles, for instance, how many of you know how long it takes for, you all, and I don't have samples. Okay, let me, somebody's already asked me. I have no samples. But if you take an edible, how long does it take to kick in? Does anybody know the answer? Anybody? An edible, a gummy. Everybody's familiar, right? Cannabis gummies. If you take a cannabis gummy, how long before you feel the effects? Does anybody know? 30 minutes. 30 minutes I got so far. Anybody else? Yeah. I heard it over there. You know it takes a couple of hours, up to around 2 hours for an edible to kick in. Did you know that? So you may take an edible, right? And you say, I feel fine. I'm going to go to Target. I'm going to go to Walmart. I feel fine. Because it hasn't kicked in yet, because it's absorbed through your stomach. Unlike smoking, which that kicks in, that's an immediate onset or a rapid onset, edibles are a slow onset. So these are the things that if you do talk to a provider, you need to learn. If you got to start slow, go low and slow, work your way, and you need to know the onset of action of what you're taking, because you don't want to get behind the wheel and then the edible, all of a sudden you feel the effects of the edible, right? So those are important things to know. And it's illegal to drive across state lines with cannabis. It's also against the law to transport on a plane, train, boat, or other mode of transportation outside of Massachusetts. So even when you go to Nantucket and Martha's Vineyard, right, you can't take it on the ferry. Even though you're like, because why can't you take it on the ferry if you go from Nantucket back to the mainland? Does anybody know why you can't take it on the ferry? Federal waters. So when you take the ferry, you're going over federal waters. And cannabis, marijuana is still illegal federally. It's a class 1 drug on par with heroin still, believe it or not. So you can't take it on a plane. You can't take it over federal waters. So my friend over there got the answer. Okay, so helpful information for you. You can't send it by mail either. And employers, landlords, cities and towns can still say, if you live in an apartment, especially federal housing, can't consume in federal housing, right? Because it's federally illegal. And your landlord can still say, even though it's legal in Massachusetts, your landlord can say, nope, not in my residence here. So you have to check with your landlord around that. Other regulations around adult use. The edibles are, remember I said potency, there's no potency caps on the medical side. Well, there is on the adult side. 5.5 milligrams of THC in a single serving with no more than 20 servings or 110 milligrams allowed in a single package, whether it's a candy bar or whatever it is. Okay, helpful information. Marijuana, Massachusetts adult use marijuana law permits you can carry up to 1 ounce of marijuana. You may possess up to 10 ounces in your house. Marijuana retailers may not sell to you more than 1 ounce a day or its dry weight equivalent. As of June, the average cost of flower was per gram $5.82. The price of cannabis is really low. It's really low in Massachusetts, around the country. And why is that? Remember when I said we started with 2 dispensaries in November of 2018? And we had very little cultivation at that time. So now we have over 3 million square feet of cultivation. So the market is really robust and flooded, if you will, with cannabis and the legal end. So as a result, and we have over 250 places that you can buy adult use, so there is a lot of products. There's a lot of inventory, which ultimately benefits you, the consumer, and benefits the patients, because the price was, double, triple at some point. So the price has come way, way down. So we added this graphic on the right because somebody asked me once, what does an ounce look like? And I was like, that's a good question. I didn't have any visuals. So on the bottom right, that's what an ounce of flour looks like: a ½ ounce, a ¼ ounce, an eighth of an ounce, and a gram. In case you were kind of curious about that. Okay, so I say you want to grow it at home. Say I've got a green thumb, I want to grow my own cannabis at home. So you can grow up to 6 cannabis plants in your home, or up to 12 plants for 2 adults in the home. Now, if you're going to decide that you're going to be a home grower and you're going to cultivate cannabis, we highly encourage you to go to our website, because it requires high-powered lamps, temperature controls, ventilation, and your circuits can overload. So there can be fire hazards with it. So, I mean, it sounds easy, oh, I'm going to grow cannabis, but it's really involved. And I've been on many tours on these cannabis cultivation sites. And it's like NASA. It's a science. Everything is controlled from water to temperature to light bulbs. There's the mother room, the plant room, the veg room, the flowering room. It really is a science. It's horticulture. And believe it or not, now colleges are offering certificates, and they're offering courses and classes on cannabis because it's such a big industry, and it really is a science to grow it. Okay, and this is important. Someone asked me this as well. The plants cannot be visible from a public space without the use of binoculars, aircraft, or optical aids. I did a talk at the Shrewsbury Senior Center last year. He's like, I can see my neighbor's weed. I can see his pot. So you're not supposed to be able to. Oh, let me go back. Okay, this is brand new. Just over, recently we announced that you can buy seeds and you can buy clones. And clones are the baby plant, and then the seeds would come in a pack. So a licensed marijuana establishment, an MTC, can now sell to you cannabis plants, seeds, and clones. Consumers may purchase up to 6 clones, a tiny plant, or there's no limit on seeds that can be purchased. Okay, so you guys know the retailers, right? You know you can walk into a dispensary, but there's many license types that are involved with cannabis, and let me just touch on them. Cultivation, I talked about. That's cultivation is where we grow the plants. Indoor, most are indoor because New England's a really tough climate, but we do have some outdoor farmers as well. We have craft cooperatives, which is when farmers get together, like cranberries, and they create a cooperative and they grow cannabis together. We don't have any of those really online yet. Micro businesses was a license type created for a small grow. They can only grow so much. It was a financially easier way to get into the industry. So micro businesses, product manufacturers, those gummies I talked about, right? Who makes those gummies? Well, product manufacturers, the seltzers now, there's ice creams, there's everything, there's solves, there's creams, there's everything you can imagine. Excuse me, I just take a sip of water. So I talked about retail. Research. Research is another area that I'm highly focused on. Since the federal illegality, there's very limited research happening. Oh, do you want to come through? Yes, of course. Come on and join us. Can you get by okay?
Thank you.
You're welcome. Yeah, no problem. So where was it? Research. So there's not enough research. There's only really one university that is sanctioned to do research. That's the University of Mississippi. Unfortunately, they have a really old strain of cannabis that they tend to use. So we really need more research. Wouldn't you love to know how it works for depression or anxiety or chronic pain, PTSD? And thank you for that. So, and I'm going to talk about that more, but I really try to help veterans as a commissioner in my individual capacity. And I've met with many, many veterans who receive their health care at the VA, and again, because of the federal illegality, they can't have that conversation with their provider about cannabis. And many of them have been on a cycle of opioids, fentanyl, right? Opioids, we all hear about the fentanyl crisis. So this Stephen Mandilli, he's a selectman now in Uxbridge, but he served in Iraq, had to get airlifted out, debilitating conditions, debilitating injuries, was on over 50 medications. He shared this story publicly, tried to take his life, was so in a bad cycle, in a dark place from opioids, and his wife said, enough, you're gonna try cannabis. And he said, I'm gonna try what? She's like, you're gonna try medical weed. And he did, and you know what? He's off of all the opioids, he's an elected official, he's a businessman, he's an advocate, and he's got his life back, and he's a dad to his daughters, and he's a husband to his wife, and he says it was just a magic medicine for him. It was really unbelievable. So cannabis gave not only him, but many veterans their life back, and what I'm advocating for is right now, a veteran gets his health care or she gets his health care at the VA, they have to pay to go get certified. We're trying to eliminate that step in the commission. So they no longer have to seek another provider because we can use their blue button report, which will show us their debilitating medical conditions. The commission voted unanimously in support of that last month. We voted unanimously to include PTSD and opioid use disorder as conditions to get medical marijuana. Transporter. We have folks that have that license that just like a Brinks truck. They transport the marijuana from business to business. We have independent testing labs. I talked about that. Every product you buy in Massachusetts has been rigorously tested for pathogens, pesticides, and potency. And there's a certificate analysis that goes with every single cannabis product that you buy in Massachusetts that if you ask for it, you can see it, and it will show you that. So that's super important. And then delivery, and then, does anybody know what social consumption is? Anybody know here cannabis cafes? Anybody hear of those? So it's legal in Massachusetts. It has been for a number of years. It's been in the regulations, but there was a glitch. Towns and cities couldn't opt in, couldn't do it. So with that law that passed last year, now they can, but the commission has to update our regulations. So right now there's a working group, a social consumption working group. I'm not on that one, I'm on another one. Kathy is, okay. And that group is working real hard to update those regulations. And there's a lot that goes into that, right? So we want people to consume safely and responsibly. We want to make sure that the air that the workers are in, that it's ventilated properly, right, Kathy? There's a lot of things that group that she's on that needs to consider. But out in the West Coast, some states already have it, Colorado, California, there's a few out already have, Nevada, have it out west, and so they're coming to Massachusetts. So cannabis cafes are coming to Massachusetts. And part of that is for like the folks I said that live in federal housing and have no place to consume because they live in federal housing. So folks and patients will have a place to consume. State of the industry, let's just go over this really quick. Cannabis is an economic driver in Massachusetts. Over 20,000 folks work in the cannabis industry. Adult use sales in 2023, so far $760 million, almost $5 billion since 2018, $5 billion with a B. Medical marijuana treatment centers, $118 million in medical sales. And then the revenue from application, so licensees have to to apply, they pay for their license fee depending on their license type, registration fees. So for the Commonwealth, that's created $13.4 million. And excise tax has created $90.2 million from July to March. So we are creating hundreds of millions of dollars of tax revenue in Massachusetts cannabis. We're creating thousands and thousands of jobs. And many of you may have noticed that, and Worcester County really is the mecca of cannabis in the state. And Worcester is the mecca within the mecca of cannabis in the state because there's a lot. But you notice that a lot of old mills have been converted, right? A lot of buildings that were vacant have been converted. So there's a lot of industrial space in Worcester County in Massachusetts. A lot of it's been converted to cannabis, which is great to see for that. So, and why is Worcester County the mecca? Because I think a number of things. I think property's cheaper than in Boston. If you go inside 128, there's more parking probably here than in the city. You know, we have a lot of those industrial spaces. So cannabis has been a huge economic driver in Worcester County here. So again, as I said at the beginning, cannabis surpasses cranberries. And then the Leaf Lease Harvest report that cannabis crops are worth $361 million, with cranberries raking at about $66 million. How about that? How about them apples? Oh my God, cannabis to cranberries. So that's kind of impressive. Did you know that cannabis for the first time last year outsold nationwide chocolate? Legal cannabis outsold chocolate. Who would have thought that? Oh my God. So let's just look at the map of New England, just so you can see how much has changed. So on your left, on 2018, Massachusetts is in green. We're the only legal state of adult use cannabis in 2018. Fast forward to 2023, look at all the legalization. The only one is New Hampshire that is not. So a lot has changed. Okay, so marijuana licenses, so there's, including provisional, these aren't all open, but there's 1,200 in the pipeline right now that it's going to come in before the commissioners. And let's see, retailers, 488 that will come before the commissioners. And social equity program, I talked about that a little bit at the beginning. We were the first state in the country, not only were we the first state east of the Mississippi to legalize adult use cannabis, but we were the first state to have a social equity mandate by the legislature. And what does that mean? That means we try to help folks that have been formerly incarcerated due to cannabis prohibition, folks that even have a spouse or parent that were formerly incarcerated or criminally justice involved. If you have a residency in a certain area that we identified that had high arrest rates, then you can qualify for our social equity program, and we will provide you technical training and assistance. We'll prioritize you in the queue. We'll waive certain fees for you to help people. There are challenges in the cannabis market. Because of federal illegality, there's no bankruptcy protection. So if you see one of these go out of business, they have no bankruptcy protection. There's no banking. Imagine that. You start a business and there's no banking. You can't go to get a small business loan because it's federally illegal. So there's a lot of predatory lending, and you have to find investors. And then there's something called 280E, which every other business can deduct business expenses from their federal taxes. Cannabis entrepreneurs cannot. So they have inflated profits because they cannot deduct business expenses. Now in Massachusetts, we rectified that, and you can in the state, but for the federal taxes, you cannot. So these are the communities. Worcester's one of them. Worcester is identified as what we call an area of disproportionate impact, that there were high arrest rates in Worcester when marijuana was illegal. So now we try to help folks in Worcester. We try to help them. We try to help them with the social equity program and the waiving of the fees and the assistance. I talked about Chapter 180, the regulations. So there's 3 working groups. There's host community agreements, municipal equity, and Kathy's on the social consumption. So we have been doing the people's work around cannabis. And then I talked to you about social consumption and veterans. So this is some of the work we did on veterans. We want to be able to identify PTSD and opioid use disorder, and we want them to be able to print out their blue button report, which was created under the Obama administration, a couple of pages. They bring it to Kathy. Kathy can certify them, and that is our hope. And that's in front of the legislature right now. We need a statutory change to be able to do that. I testified the week before, last week in favor of Bill H-119, and it's in the House, and S-50 in the Senate, and hopefully that'll pass, and we can help our veterans who have done so much to protect our freedom. And that's my talk, but if anybody has any questions, I was so honored to be here with you. But I said to Suki, what an honor to go before the king of rock, because I guess Elvis is next, and I said, so the queen of cannabis went in front of the king of rock. So anyway.
It's like we're missing an opportunity for added income with the excise tax rate compared to, let's say, the tax on cigarettes or the tax on gasoline. What's your thoughts on
So you're proposing a higher excise tax?
why not? I mean, we do it on cigarettes, we do it on gasoline.
Yeah, well, see, that's a legislative fix. So with cannabis, it's like multiple things, and thank you for that question, by the way. So there's local control, the host community agreements, the social consumption sites. That's all decided locally. And then we do the regulations. So we don't create the tax rate. That's a legislative fix. So you have the legislature that does statute, and they can dictate the tax rate. And then you have the commissioners. We create the regulations and the policy. You have local control, and then you have federal control, which is, it is illegal. So that's something you'd have to talk to your state rep about. Like, that's out of our lane in the commission. But I'm sure you'd hear proponents for it and against it, because then it would drive up the price of the adult use. But yeah, back to that excise, back to that hundreds of millions of dollars. It goes to a marijuana regulation fund, so you know where your tax money in cannabis goes, and then it goes into like 10 pots, and some of it's for substance use treatment, some of it's for training law enforcement, some of it's for restorative justice. So it doesn't just like disappear, it's designated to go into help certain areas. But every community has benefited from the marijuana regulation fund and the tax dollars that have been raised through cannabis. I think was another question.
Any record relative to the increase in traffic under the influence and bringing compensation claims relative to consumption?
So Thank you for that question. There's no updated laws around OUI and marijuana. And Governor Baker had filed the Clardy bill about a year and a half ago. And I don't know if you remember this story. It was kind of local. Trooper Clardy was a state trooper. He got killed on 495 by someone that admitted to being under the influence of cannabis. But because there's a lack of settled science, alcohol is water soluble, so there's a breathalyzer. If you get pulled over, and if you blow .08, you're legally over, you're intoxicated. But cannabis is fat soluble, and there's no breathalyzer, because you could consume safely on a Saturday, and 30 days later, it could still show up in your system. So there's no way to prove right now, there's no settled science on peak impairment. So that's why I was so steadfast to do prevention and education with young people in the driving school, because we need to let them know and tell them the facts. So until the science is settled that they can show peak impairment, there's been no update to the OUI laws. And as far as workers' compensation, I don't know about any claims there, but what I do know is that there are bills being filed right now at the State House about testing, drug testing for workers, because you could be a patient, right? So you could be a medical patient and then get drug tested on a Monday and fail. So that's a concern of, right, Kathy? That's a concern of a lot of folks. So that is in front of the legislature right now around maybe easing the testing requirements for some occupations.
But in general, has there been an increase in accidents relative to anything?
Yes. Well, yes. And you look at AAA has studies out. NHTSA, the National Highway Transportation Safety Administration, has studies out that do show an increase. Sadly, what's happening is when they do test and there is a fatality and they test, and UMass was one of the sites in the study, a lot of people are poly-use. So you know what I mean by that? So they're mixing alcohol and cannabis or other drugs. So yes, there has been an increase, but there's the National Highway Transportation Safety Administration study you can look at, and AAA Northeast had put out. It depends on the study. But some studies have shown that fatalities, yes, have increased.
Where is your office?
Oh, thank you. I should have said that. Our office is in Worcester. Yeah, Union Station. Second floor Union Station is the Cannabis Control Commission. I think we're the only agency to have our headquarters, state agency to have our headquarters in Worcester. So, thank you for that question. I should have said it. Suki.
Is there a difference between oil and gummy bears?
Yeah, the oil, there can be, the oil or tincture usually goes sublingually under the tongue, and then you usually chew and swallow the edible, which gets absorbed in the stomach. So, and then sublingually gets absorbed a little quicker, and the tinctures can be a higher potency as well. But.
What about creams that apply to, say, Africans and these and
Right.
like that? Is that something that is, I'm okay, I think.
Yeah, that's in the TV.
My question is about the creams that can be applied to, to joints and
Right.
things like that.
So thank you for that question. And we do see a lot of creams out there. And let me just extrapolate. You see a lot of CBD creams, right, out in the market. Now that's hemp. And that has less than 0.03% THC, so there's no psychoactive effects. And then what we do regulate, if it is regulated by us, it will have a THC, CBD, can be infused. So I have to be Switzerland, and I can't advocate for a modality. What I can say is they're enormously popular. You need to talk to your provider to see. I've met anecdotally many people that the creams have helped them. And there's balms and salves and everything else. So I have met a lot of folks, but that's really a conversation that you need to have with your provider. If you're going to have one with the CBD and the THC, and you want to get it medically, then you should get certified as a patient, because then you wouldn't pay the tax on that. But it's definitely, it's helped a lot of people that I've met along the way, but I can't advocate and say that's for you or that would be perfect for you.
Now, you mentioned about talking about it in driving school, the influences of marijuana.
Yes.
As an educator, my question is, what are we doing before they get to driving school to make them aware of the effects of marijuana?
Well, that's called mom and dad or their whoever takes care of them. When they're age appropriate to have that conversation. Thank you for that question. To have an age appropriate discussion, especially if parents are patients, right? And the kids see there's products or gummies. So I always say there's a few things I say constantly. If you're going to consume safely and responsibly, and please, please lock your products up. When you're not using your products, they need to be locked. And they need to be in safe storage because accidental poisonings with toddlers and young people are at an all-time high. It's up over 1,000% nationwide. It's happening where young toddlers, they don't know it says adult only. They just see a gummy, right? They don't know. So especially if teenagers, then you got to get more creative on how you lock your stuff up. So that's really, I'm glad you brought that question up because it is happening. There are accidental ingestions. I had an opportunity to meet with the Department of Public Health in all 4 Western Mass counties. And we're trying to work together to put our heads together. We have more about MJ on our website, but we need to really have public awareness around safe storage is really, they say if you have a firearm, you need to have that safely stored. Well, if you have cannabis and you're not using your cannabis, that really needs to be safely stored. Mm-hmm.
What are the other effects of marijuana completely on your mobility, on your mind, and things like that? Because I've known elderly people that have that
Right.
has having a fall or something. So it's not only helping them with their physical pain, but what else is occurring to them that they need to look out for?
So a part of the regulations is, is consumer education. And part of the consumer education is learning about the plant, learning about the effects of the plant, starting slow and going low. You have to have that talk with your healthcare provider. Because for my mom, right, I told you she has autoimmune disease. What I didn't tell you is she has vertigo. What I didn't tell you is she has Meniere's disease, right? So you have to be careful. So there has to be that talk with your provider because I don't want to trigger her vertigo and I don't want to trigger her Meniere's disease. But a lot of older Americans, will use products that have CBD and THC because they kind of cancel each other out, so you don't get that effect in your head. There are high potency products that you will feel high for sure, no question. So that is a talk that you need to have. Not every product makes you feel high. They don't all make you feel high. But that's a talk that you have to have with your provider. So thank you for that. Any other questions?
I understand that if you buy it on your own, there's a 20% tax. And avoid that, if you have a condition that allows you to be medically certified, I presume the cost of getting medically certified and recertified every year is a fee.
Kathy, you want to take that one?
I absolutely will.
Is that fee?
You're right.
I presume it's not covered by like Medicare.
No.
It's a federal program.
Right.
You're absolutely right. The fee for the healthcare provider, the doctor, is not covered by Medicare because we're not classified at the federal level. And every provider sets their own prices. The providers are actually overseen by the Board of Medicine, but they do have to register with our program to have access to the system in order to see patients. But they set their own prices.
Do you have any idea what the average recertification fee is?
I'm hearing average around 100, 150, sometimes 200. And
That's every year.
Yeah, that's every year. Now, if there is federal movement and there is a game changer, like that would be it, right? Imagine if a major health insurance company said we're going to cover, they didn't cover acupuncture, right, about a decade ago, but they do now, a lot of them. So I'm hopeful that there will be a game changer where a major health insurance provider will cover it, or if there's any movement federally, and I think there's bipartisan support, I do, for that. So that would be in research, right? If we have research to show that it helps the...
There's that line between, well, when does my 20% exceed the cost of being certified, right?
Well, that's an option you got to weigh, right? So if you're buying a couple $100s a month of product, then that's a savings pretty, 1 month in, you've already, you've already washed that out, that cost. So that was a good question, thank you. Any other?
There used to be lots and lots of ads about the harm of smoking
Yep.
on the lungs.
Yep.
It seems to me that since cannabis became legal, you don't hear anything, I mean, nothing
Yeah.
about the harm of smoking.
Yeah.
Other than years ago, reading that it's so much stronger than cigarettes.
Yeah, well, I'm sensitive to that. I had my dad, who was a veteran, was a, she's just saying that years ago you'd see a lot about secondhand smoke and smoking on the lungs, warning on cigarette packs, on cigarettes, and you don't see that as much. So what I can say is I'm very sensitive to that. I had a father that was highly addicted to cigarettes, and he passed away at the age of 60 due to stage 4 lung cancer. So I'm very, very sensitive to that. Not everybody smokes cannabis. A lot of people do gummies, tinctures, creams. Not everybody inhales cannabis. There still needs to be research on what those that do smoke, what the effects are on their lungs, and I'm hopeful that someday we will have that research. But right now, there's not a lot of robust research around that. So, but thank you for that. I am very sensitive to that question.
Are there any plans to legalize hemp?
Wait, where's it?
Plants.
Oh, okay. Hemp is legal. Did you say hemp?
Yeah,
Hemp.
because last I looked, you need a special permit to grow it, no matter
Yeah,
how.
so you do. We have hemp farmers in Massachusetts. We have a lot of hemp farmers in Massachusetts. That's not under the commission. That's under MDAR, which is the Massachusetts Department of Agriculture. They oversee MDAR, and when I said with a CBD, right, that's hemp. And that's
That's why I'm wondering,
yeah.
why do they exclude it? Because it's a very nutritious
It's
plant.
been historically under the Department of Agriculture, and that's where it remains. It does not remain under us. When it does come under us is when a cannabis product is infused with the CBD or and then that comes under us for those products for certification. But so again, I'll repeat: the hemp has a lower THC. It can't exceed 0.03%, and you don't get that psychoactive feeling. So thank you. Anybody else? Before Elvis? Yep.
There seems to be a lot of lack of research about things. How much is Massachusetts spending in that line?
Well, there's a bill in the State House, nothing.
That's not
Yeah.
good.
So right now there are no public dollars going to research, and I'm hoping to change that. I'm working with my friends in the legislature. We have a bill to hopefully get some investments from that marijuana regulation fund that we talked about, those hundreds of millions of dollars. I'd love to see, we have the best universities in the world. We have the best hospitals, right? Boston, we have the best hospitals in the world, right? But they can't touch the plant. And why can't they touch the plant? Because they get federal grants and they get federal dollars. So all of these amazing hospitals and universities that we have in Massachusetts can't touch the plant to help us with the research. So hopefully that'll change too. Okay, and there's Elvis. Yeah, okay, any other questions? Yep. All right, last question.
Is there a going price that every seller, what is
So I showed you, it's just over $5. It was like triple that price. So you can go on our website and we have the price listed monthly and it does fluctuate. So it's just over $5 right now. So it's low. It's at an all-time low in Massachusetts because there's so much inventory. There's over 3 million square feet of cannabis being grown in Massachusetts as we speak, and 5 million more square feet right around the corner in provisional license. So there's a lot of cannabis canopy in Massachusetts. So that keeps the price low. Okay, I think, Suki, are we good?
How terrific this presentation was. Thank you so much. We learned so much
Thank
today.
you. Thank you, Kathy.
Thank you, Kim Roy.